So the Liver and Biliary Multidisciplinary Clinic here at Johns Hopkins is a clinic composed of specialty or subspecialty trained experts in areas of radiology, surgery, medical oncology, radiation oncology, and hepatology, all that come together to perform an in-depth review and analysis of a particular patient's scenario to formulate an integrated plan to promote their best outcome.
So the liver cancer, biliary cancer, biliary tract cancer multidisciplinary clinic is a clinic that meets weekly. We meet on Wednesdays, and patients come there to be assessed and to have their cases reviewed by a team of experts. We meet, we review their cases, and then come up with a comprehensive treatment plan for the patients.
So here within the Liver and Biliary Multidisciplinary Clinic, I am a hepatobiliary surgeon, meaning that I specialize in the surgical resection of issues of the liver and bile ducts. And my purpose is to review and consult with patients to determine if surgical resection is right for them.
So I'm an oncology nurse with many years of experience. I'm really the point person for the people who are coming to our clinic. I'm their first point of contact. I speak to them about what records are needed. I review their records. If there's any testing that needs to be done, I will arrange for that testing to be done before the team meets in the multidisciplinary clinic. I arrange all their appointments and provide a lot of education and support for the patients, not only before clinic, but during clinic and even after clinic. For these patients, it's a very scary time. They're very vulnerable. They don't have their treatment plan yet. And so I do my best to expedite their appointments and get them in as quickly as I can.
As a medical oncologist, my specialty is treating cancer with medicines, including cytotoxic chemotherapies, as well as newer forms of treatment such as targeted therapies and immunotherapies. In our clinic, we see patients who have primary liver cancers, including hepatocellular carcinoma. That's the most common form of liver cancer in the United States, as well as patients with rare forms of liver cancer, including biliary tract cancers, cholangiocarcinomas, gallbladder cancers, and fibrolamellar hepatocellular carcinoma.
Yeah, some of the unique factors to this clinic is that the clinic is composed entirely of subspecialty trained experts from all medical disciplines to formulate a plan for patients with issues of the liver or bile ducts. And I think here at Hopkins we have a vast array of offerings for patients with disorders of the liver and bile ducts. And together we're able to come up with a plan that's best for the patient. So I would say here in the multidisciplinary clinic, it truly is a team, and it's a team of all-stars. And we work together on a daily basis. We're constantly thinking about patients, constantly thinking about the best plan of action for a patient, and how to integrate a treatment plan to promote the patient's best outcome.
The care of patients with liver cancer is very multidisciplinary. And before we had this multidisciplinary cancer clinic, patients often had to have different appointments with different specialties. When we developed this clinic, the goal was for patients to come to one place and to have a team of experts sitting together in a room, looking at their scans together, looking at the pathology together, and formulating a single cohesive plan to present to the patient. We think that this is not only more convenient for patients, but it also results in having a much more coordinated plan of care.
I think patients visiting the Liver and Biliary Multidisciplinary Clinic can expect an in-depth, detailed analysis and review by a team of expert subspecialists to formulate a comprehensive and integrated plan all in a single visit.
So the patients will come, they'll get checked in, they'll get a set of vital signs, they'll have a physical exam done by one of our team members, and then they will meet with all the different providers that are part of their treatment plan. They'll meet with each of those providers individually, one right after another, and at the end of clinic, at the end of their appointment, they'll actually leave with a comprehensive treatment plan in hand so they know exactly what to expect. And this is for patients that come for a second opinion to us and are going back locally to their team. They can take that plan with them to their local team, or patients that are seeking care here at Johns Hopkins.